Good evening, everyone, and welcome to Hartford Public Schools Virtual Town Hall, Health and Safety Update for the school year. I am your superintendent, Dr. Leslie Torres Rodriguez, and I will be joined today by our district leadership team, as well as by our very special guest and medical expert, Dr. Juan Salazar from Connecticut Children's Medical Center. We're going to just do some quick housekeeping just to review how it is that we're going to interact and get through the session. So in our next slide, we can see that after the presentation, we will share a question and answer opportunity. Right, you can add your questions in the YouTube chat. So you'll use the link to our YouTube stream, as you see on the screen there, to ask questions. So we're gonna get started, and I will, before we begin with the presentation, I'll take a moment to ask our team, our amazing Hartford Public Schools team, to introduce themselves, and know, team, that you are appreciated for all the work that you do every single day.
Thank you. Hi, good evening, everyone. My name is Viviana Alvarado, and I am the Family Engagement and School Governance Council Manager with the Office of Family and Community Partnerships.
Good evening, everyone. I'm Yvette Avila, Chief of Schools.
Good evening. I'm Deb Comides, Health Services Coordinator for the district.
Good evening, everyone. Nishette Blackburg, Chief of Family and Community Partnerships.
I'm
John Fergus, Director of Communications.
Ziba Kashef, Assistant Director of Communications. Good evening.
Good evening, Madeline Negron, Chief of Academics.
Good evening, I'm Dr. Bethany Silver, Chief Performance Officer.
Good evening, my name is Ed Wilson, Staff Attorney with Hartford Public Schools.
Hi everyone, my name is Michelle Sinkowitz. My pronouns are she and her, and I'm the Community Partnerships Manager at Hartford Public Schools.
Good evening, my name is Deborah Zimmerman Hers. I'm the Communications Coordinator for Hartford Public Schools. Good evening.
And I'm Elizabeth Dill, Chief of Staff Fellow for the district.
Okay, team, I think we're good with introductions. So thank you for joining us. And thank you for joining me in connecting with our families. Just to review the agenda, we are going to do a quick review of our 3-year plan, the family feedback that we received, and the new academic and social emotional supports for the new school year. We're going to review our return to learn and the health and safety protocols, and then get into what you're probably looking forward to the most, which is the conversation and the medical expert updates, and getting to your very specific questions. So this year, as some of you might remember, that we were working really hard at the end of next year, leading into this year to,
you want to put
can
a
I just ask everyone to mute, please? Thank you. We worked really hard to incorporate all of the feedback that you all had given us to develop the plan moving forward over the next 3 years. And we started those conversations grounded in what we call our district model of excellence priorities. So those priorities did not change, right? We're still focused on providing high quality teaching and learning to all of our students, ensuring that that is happening in a welcoming culture, classrooms and schools. And we know that we want to do that in partnership by engaging our family and our community partners. And we also have to make sure that we have skillful, talented, supported staff, and that we do our work in the way that we say we're going to do it, right? Having effective operations and making sure that we do all of that so that we can support our students as they are, so they can be successful in school and then, of course, right, beyond school. So we engaged in our planning process by gathering early input in the fall through what some of you might recall as the Fall Learning Experience Survey. We had conversations with our school leaders. We had feedback sessions, focus groups with students, families, staff, and our community partners. And, you know, as the months progressed and as we were balancing and managing the pandemic, we also were working on planning ahead. And where we are now is we've begun to implement our plan, which was informed by all of the feedback that you all told us. And I'll share a few of those feedback points because we started in our next slide, we started our survey by asking our community the goals that mattered most. And there you go, our next slide, thank you. And you can see here a quick glance that we learned how our families and our stakeholders were prioritizing across our 4 goals. Right, so we saw a strong emphasis on improving our 3rd grade literacy and chronic absenteeism, right? That's why we continue to communicate that we want students in school each day and in every class, right? It matters to be in school every single day. When we asked our families, students, and staff which of the strategies in each of those priority areas was most important to them, you can see here that within our priority of high quality teaching and learning, and also our priority of welcoming culture and nurturing climate, which is in the purple area, there was strong consistency when you see, right, both bar graphs there. Our community overwhelmingly prioritizes having a strong system of supports. You all said to us, we want to make sure that students have supports to address the academic areas, but also the social and the emotional needs of students. And our community puts roughly equal weight on family engagement and also making sure that we provide our students with real world learning opportunities. So as a result, we made sure that we put relatively equal emphasis on these 2 strategies in our plan. And finally, we asked our families what would need to be true for your child to be successful over the next 3 years. And you can see there on the left a word cloud of responses that we received, and we even included some representative quotes from families. But overall, there were 5 themes that we heard from our families. And just to share that we had over 2,000 responses. We had five overall themes: high quality teachers in every classroom, safe, positive learning environments, more extracurricular and enrichment activities for students, and making sure that we supported each individual student's unique needs. And we heard from our families that families wanted help and support in order to help their students learning at home, right? Which these are all great areas for us to make sure that we respond to and provide supports in. So we used all of the information and we developed the plan. And through the additional funding that was provided to us from the state and the federal government for relief funding, we identified very specific areas that we wanted to invest relative to academic and social, emotional, mental health and wellness supports. And you can see here some examples of right, how the plan is going to benefit our students and our families. We know that we are having extended learning time, right? Summer opportunities for students, summer learning opportunities on the weekends, in the evenings, during our vacation sessions, we're having learning opportunities. We have more, we have smaller group learning opportunities in K through 3, third grade, and then in our 9th and 10th grade in schools and in grade levels, in those grade levels that have a higher level of need, that students need more support, they're going to have smaller class sizes. Additionally, having one-to-one or small group support and tutoring. And, you know, as it relates to some examples for family support, we are expanding our community school model. So we went from 8 schools to 13 schools where, you know, students and their families have supports throughout the school day, in not only academically, but also in terms of supports for families, mental health, wellness, medical support for families and students. And that is across 13 schools. And so these were some of the examples that we wanted to highlight in terms of our programs and supports, because I know that you know, our students, many of our students needed additional supports before the pandemic. And now, right, the pandemic has exacerbated, deepened those needs. And we wanted to make sure that we were responsive to what you all told us. So all of those program supports go hand in hand with the health and safety mitigations, because we know that we have to keep our students, staff, and families, and ultimately our community safe. So in our next slide, we are just have a quick overview of our health and safety and our mitigations. And essentially, there are 4 key changes from last year. I know that, you know, there were about 40% of our students, about 6,000 students at one point, that actually have not come back in person, and they will be coming back to us on next Monday in person. So they've been out of the in-person learning experience for almost 18 months. So there were 4 key changes, and one is exactly that one, that all students are going to come back to full in-person learning. Another key change from the mitigation strategies from last year is that vaccinated staff and students will not need to quarantine if they are asymptomatic. So if we have someone that tests positive and they have no symptoms, they do not necessarily have to quarantine. And a big change that we want everyone to be aware of is the change in the definition of close contact. If you recall, last year, we were defining the close contact as being within 6 feet. That has changed. Right now, we are defining that as within 3 feet. This is per not only guidance from the Centers for Disease Control, but also local and state health officials. And lastly, visitors will be allowed moving forward in our buildings, right, including our families and our community partners. Of course, they would have to complete a health screener and follow all of our protocols. There are a few other mitigation strategies, all of which, you know, many which were implemented last year. So of course, masks for everyone in our school buildings and in all of Hartford Public Schools facilities. Regardless of your vaccination status, everyone is required to wear a mask. We are going to continue to cohort students in our grades pre-K through 8. It is a recommendation that we're actually taking a step further and requiring across our schools. And the remaining ones, you all probably are aware of them, right? Washing hands frequently, disinfecting. Unvaccinated staff is still going to be required to do their daily screener. And we continue to collaborate with our local and health authorities, which is why we have, right, Dr. Salazar here with us tonight. And, you know, before I turn it over to Dr. Salazar, I do want to share a few updates as to vaccinations rates for us. You know that last spring, we worked in partnership with many of our local health providers, offering mass vaccination to our teachers and our staff. And currently, 76% of all of our staff, that means staff in schools, at central office, teachers, custodial staff, cafeteria, the cafeteria teams. So 76% of staff have been vaccinated. We still have staff, as you can see, close to 19% of our staff that we are awaiting to know of their vaccination status. And more specifically, as we think about the staff that is going to spend the larger amount of time in front of our students, our teachers, we know that 85% are confirmed to have been vaccinated. We continue to work to ensure that our staff share with us their vaccination status. And as recently as of last Friday, we know that the governor released an executive order that has additional requirements for vaccination for staff. And lastly, with regard to students, just as quickly as we moved when staff vaccines became available, we did the same for our students. And as of today, 34% of students that are 12 and older are fully vaccinated or have received their first dose. We continue to have opportunities for students, families to have access to the vaccine. So that is a very quick overview of not only how your feedback is showing up in our plans and the supports that we are going to have available for students when they return, but also an update on our mitigation and health and safety strategies. And all so that we can now transition into the conversation with our very special guest who will speak to us, who will answer our top health and safety questions around the COVID vaccine, of course, the Delta variant. There's a lot of conversation about that, and about how we can safely return to in-person learning. Dr. Juan Salazar is Physician-in-Chief, Executive Vice President of Academic Affairs at the Medical Center. He also is the Director of the Pediatric and Youth HIV Program at Connecticut Children's, and serves as a professor and chair of the Department of Pediatrics at the UConn School of Medicine. How fortunate are we, Dr. Salazar, to have you with us, and so grateful that you are taking time to join us. And we're looking forward to learning from you.
Thank you very much, Dr. Torres Rodriguez. I was very impressed with the work that you and your team are doing with the schools to get the kids back to school safely, which is so important after a most difficult year, most difficult 18 months really for everyone, especially the families and the children and the adolescents that benefit from the school and have not been able to get back in full gear. And hopefully this year we'll be able to make it through. So what I can do is perhaps if I can share a couple of slides, I think might be just to give a context of where the pandemic is right now for everyone who's joined in. So if you can let me share my screen, I will go ahead and do that. I'm not sure who has this one.
Yes.
All right. Okay. And so I'm just going to open. Let me know if you can. I'm just going to put it on presentation mode. And can you see that? I'm not sure which one you're seeing, if you're seeing the presentation mode or the actual full slide.
We see presentation, so we see both. We see yours and ours.
Okay, but you're, all right, let me, okay, how about there?
Great.
Okay, so again, I just want to highlight the magnitude of this infection, and I always present these slides to our entire staff here at Connecticut Children's. We have about 2,800 people that are employed here. Many live in the city of Hartford, and they always want me to highlight to them what's going on around the world very briefly, and then the U.S., and then zero in on Connecticut because that's relevant to reopening schools. The first thing is in this map here, which is from Johns Hopkins, it shows the total number of cases in the world, astonishing number, 212 million cases throughout the world. This other figure, in white here, is the total number of our fellow world citizens that have died as a result of COVID-19. 4.5 million people have died, and I know many of you have had family members and relatives who have passed, and it's a tragic situation. I know many of our citizens from the city of Hartford have died as a result of COVID-19, and many have been very sick with it in the hospital. So I think you know how this has affected, especially the elderly in our community. And if you see that red graph there on the right there, it's each little bar there represents the weekly cases throughout the world. And you can see July 2020 to July 2021, then you see an increase in the last part all the way towards the right. That's the latest wave, which is related to the Delta variant that everyone has heard about in our community. So this is the world. Now, this is what's going on in the USA, right? Almost 38 million cases as of last night, 9:21 p.m. And very sadly, 630,000 Americans have died as a result of COVID-19. And it's not just in last year. You can see here this 28-day figure, which is in the last 28 days, the last month, 18,000 people have died as a result of COVID-19. And you can see the red graph here. Again, you can see that uptick in the red here of number of cases. A lot of that is from the south of the United States. And I'll show you that in just a minute. And so let's now move into this figure here, which I use also. And let me walk you through it so that it makes sense. This is a predictive model. This is from MIT up in Boston, and they use a number of metrics, number of calculations to try to predict the number of active cases, how many cases on any given day, how many people have COVID on any given day, okay? And this is for August 31st, so next week. And dark means more active cases, yellow means fewer active cases. And you can see here in the South, Florida, Louisiana, Mississippi, Alabama, Georgia, very dark here. And that means they have a lot of active cases per million, a lot of them. Now, the good news for us is in Connecticut here up in the Northeast, while we still have a lot of cases, it pales in comparison to the numbers down in the South. But it's not zero. We still have a lot of cases, almost 2,000 per million. Back a month and a half ago, this number had dropped to about 240 per million. So we actually have increased. And that's due to the Delta variant without any question. But notice the South and some of the states on the west, Idaho, Wyoming, Montana, also a little dark. The Northeast, better. And there's a reason for that. So, and there's a reason I'm telling you this. And this is another graphic, which is really, really new. And I found it to be very important. And let me walk you through it. Here's the US. And what it is they've calculated, they did a survey. They sent a questionnaire to families and they asked them, will you, first of all, are you getting the vaccine? Yes or no? And what is the likelihood you'll get a vaccine? Yes or no? And some people will say they'll never get a vaccine. And they came up with a score that it's as follows. So if people were getting the vaccine and they had no hesitancy for the vaccine, then there was the dark blue. If people were very hesitant in that particular county to get the vaccine, then you're looking at the dark red. And what looks very apparent here is that the South, here you have the southern states, Florida, Some states, again, in the West, Idaho, Montana, and Wyoming, have a lot of red. Texas is a lot of red. That means that in each of those counties, there's over 20% of the population that said, absolutely, I'm not getting a vaccine. This is not for me. We're not getting the vaccine. As opposed to the Northeast, which looks very good. And our colleagues in Vermont, a lot of dark blue, which means that most of them, 95% said, absolutely, I'm getting the vaccine and we'll get the vaccine. If we go back to this map, where dark is bad, and in this map where the red and yellow is bad, it correlates really well. And why is that? Is because people down here, people in the West, have not gotten vaccinated. And this virus is playing havoc. Delta is playing havoc. We're much better. Now, Connecticut is right over here. We have some darker blues, but we do have some lighter areas in the community. Now, in the city of Hartford, I don't have the specific number for the city of Hartford, but we're not there yet. There's still a lot of hesitancy, and my hope is that I can convince you, if you're listening and you're not vaccinated, that it is really important to get vaccinated for you and for your kids. It's really not just for you, but it's also for the community and the kids that you have around you. Now, people have said to me, well, COVID really doesn't affect children, and not true. Okay, not true. This is from the American Academy of Pediatrics, and it's a complicated graphic, but what it shows is these are the pediatric cases per week. So each of these lines, the one on the right that says 180,000, those are the confirmed cases of COVID-19 in pediatrics in the week of August 12th to August 19th. And you can see there were 180,000 kids last week in the United States that had COVID. We had gone down to about 8,000 back in June when things were better, but Delta, especially in the South, has really contributed to this rapid increase in cases. So what about Connecticut? Okay, this is very relevant to what Dr. Torres Rodriguez is trying to do with the teachers and everyone on this call. And where are we and what does it mean for you? This is another graphic I use. This is from the University of Washington, and it's looking, and let me walk you through it. Here on the bottom part of the graph, it's months. It goes from December 2020 all the way to December 2021. And what it does is it tells me the number of estimated new cases. These are not active cases, but new cases per day. How many new cases appear in any given day? And what you can see here that on the left, this was the winter surge that we had. You still, all of you remember the winter surge, where everything was closed, locked down. And then we got better. And then we had a hump here in April, which was the resurgence of the virus that came back. Vaccines came in here, and obviously they started in December. I got vaccinated on December 18th, and then people started getting vaccinated. And guess what happened? It dropped dramatically. All the way to, you see this well here at around June, where we had very few cases. But not everyone was vaccinated, unfortunately. Not everyone followed the directions, with hesitancy concerns. And the kids are still not vaccinated, especially under the age of 12, because the vaccine is not licensed. And Delta showed up. This is the coronavirus that's very contagious. A lot of virus that gets through. And you can see that August 24th, we have almost 4,000 cases per day. So it went up again. And what we predict is that this will continue. It's probably going to peak in about 2 weeks, and then it will begin to drop again. And what's going to make it drop? Increased vaccination. That's going to be critical. Increased masking, so that we continue to use the masks, that we do the social distancing 3 feet as is recommended by the school. Washing your hands, doing the things that we normally do. But the most important message that I can give to the parents is, please, you yourself get vaccinated and encourage your community members to get vaccinated, because this will save your life. It would also avoid, getting your kids sick potentially. And certainly if you have anyone over the age of 12, those kids are eligible for vaccination. And the vaccines are very effective and safe. Last graph I think that I have, and then just one more, is these are the number of COVID cases in Connecticut. Right now, the highest number, this is total from the beginning of the pandemic, by 100,000 in all of Connecticut. the most affected population is 20 to 29 years of age. You know, people, I hear a lot from 20-year-olds who say, I'm not going to get it. I never get it. It's not going to be a problem. Not true. 20 to 29-year-olds, 14,000 cases in Connecticut since the beginning of the pandemic. 10 to 19, 9,000, and 0 to 9, 6,000. So it does affect the pediatric population. Now, the good news for children, for smaller children, is that they do much better than the 80 and over or 70 and over, you know, where the disease can be quite dramatic and serious. But younger kids can get infected and they can get sick. And the way to prevent that is vaccinate anyone who's eligible for the vaccine over the age of 12. And as soon as the vaccine becomes available, and we'll work with the school system so that Connecticut Children's can be a partner in that process. And once the vaccine becomes available, and I'm hoping it's going to become available for 5 and 12-year-olds for the next month or two, we'll work with you to make sure that the kids have the ability to get that vaccine. So and then I think I just have one more slide and then I'll finish. Connecticut has done well. Connecticut has administered at least one dose to 2.5 million people. The total population is 3.5. We still have 1 million to go. Now, a chunk of that, those are the kids that they're not eligible yet. It covers 83.3% of the eligible population, 12 and older. And that's similar to what Dr. Torres Rodriguez was showing for the teachers. I think they're at 85%. That's pretty good. We want them to get to 100% ideally if you can. And that's 72.6 of the state's entire population. So 2.3 million have been fully vaccinated. So Connecticut has done really well compared to other states, but we're not there yet. And in the city of Hartford, we need to do a lot more work with our population. I think there's still a lot of vaccine hesitancy. And I think it's important that I want to make sure that I'm able to provide answers for you as we go through this to this webinar. So those are my opening remarks. I am confident in what the school system, both at the state level and the city, has planned and is doing. I think they really planned it very nicely with vaccination of teachers, vaccination of staff. I hope that the 12-year-olds and above get vaccinated. Using the mask is going to be absolutely vital and critical. That is another contingency method that actually will keep you safe. I think the distance of 3 feet has been shown that in a classroom it's safe by doing it that way, and doing proper testing and then identifying. And if your kid is sick, if your kid has a runny nose and a cough, that's a kid that really should not be in school, and we need to test that child, and we need to work with the school nurses, work with your pediatricians, work with us at Connecticut Children's so we can make it easy for you, so we can actually diagnose COVID early if that's what it is. It could also be something else, but vaccination helps. Lastly, I want to encourage influenza vaccines. Very important. You know, this is another preventable disease, and because both of these may occur at the same time, it's good to be able to be vaccinated against influenza, which is available for any age starting at 6 months. And so I encourage you to also have your kids and yourselves vaccinated for influenza. So that's what I have, and I'm happy to take questions, concerns that people have. I know that this is a very hot topic, and I just want to say I take my hat off to all of you because it's been a very trying year. I'm happy that the kids can come back to school. I think they need it. I think learning in school with the great teachers that you have is something that is really important, getting back to the sports activities, but doing it safely, following the guidelines. And the last thing is obviously one thing we've learned in the pandemic is that we have to be able to change if we need to. If this virus changes and the cases go up in a school, et cetera, I think we need to be able to very quickly get some recommendations from us and other public health experts, and then trust that the leadership under Dr. Torres Rodriguez will react immediately to make sure that the kids stay safe. I'll stop there and then happy to take questions.
Thank you, Dr. Salazar, for not only giving us a global perspective, but also a local perspective. Yes, I hadn't thought about the flu vaccine. And so, combining those two and how important that is. So thank you for sharing that as well. We do have several questions that came in ahead of time. So I'm going to just ask two that I think go hand in hand. And then we'll go to the other questions from our audience. One is, what is the Delta variant? Like, how is it different? And if the vaccine is effective, then why are people getting sick after getting the vaccination?
Yeah, those are great questions. So I'll begin with the Delta variant. So this virus, which is it's called coronavirus, and it's corona because it's got little spikes that looks like a crown, right? That's why it's called corona, not related to the beer, but to the actual crown. And those spikes that make the crown, they're called spike proteins. The spike protein sits on the outside of this little tiny virus, and those spike proteins are the keys. That spike protein is the key to get into your cells, into your body. And it's pretty straightforward. You have a cell, here's the virus, spike protein goes in and basically unlocks the cell and it gets in. Once the virus gets in the cell, it creates all kinds of problems. And the original virus was the one that came out of Wuhan, China, had a very specific address of that spike protein. It was one that, there was a very specific, it's like, think of it as a city block. You have the street and you have the address to that home. And I'm just going to make this up. It was, 100 Washington Street. That was the name of that spike protein. As the virus begins to transmit to other people, it begins to evolve, and it's taken time to evolve. And what it does is that spike protein can change. Little tiny pieces, amino acids, which is part of what makes the protein begin to change. And the Delta variant is basically the same virus with that spike protein that looks a little different than the original one. And that little change makes that key far more effective to get into your cells. That little change is also associated with much more virus being produced as opposed to the original strain. So the original strain was infectious, contagious, it got into cells. This new strain is more contagious, more infectious, and smarter, if you may, in its ability to get into cells. It can be transmitted more easily than the original virus. So the original virus, if somebody had COVID, they could transmit it in an open room to 2 people. This new one, the Delta variant, if somebody has the virus, they can transmit it to about 7 or 8 different people at one time because there's more coming out in your nose. So those are the characteristics of the Delta variant. As these variants appear, basically they look at the spike protein and how it changes. So there's a lambda, and there'll be an epsilon, and there'll be others that will come down the pike. And that's just a name that people have given it to try to differentiate different viruses. In Connecticut, over 75–80% of the virus now is Delta variant. That's the first part of the question I think you asked. The second part is, okay, so if people are vaccinated, why are they still getting COVID? And that is correct. With this Delta variant, people that are fully vaccinated can get a mild disease or mildly symptomatic disease. In some cases, especially if people are immunocompromised, so if they have severe cancer, if they have an immune deficiency, they can get sicker even if vaccinated because their antibodies drop. And so not every vaccine is perfect, but what the vaccine does, regardless of whether you have breakthrough infection, is that it truly prevents from severe disease and death. And that we have seen. There's one figure that I didn't show you, which is very striking. And it shows that in people who never received the vaccine, which is from the beginning of the pandemic till now, we've had I showed you the number, 620,000 deaths or more, people that were unvaccinated. Of those that have been vaccinated, starting in December last year, there have been 150 people who have died, all of those immunocompromised. The difference is astonishing, 650,000 to maybe 100 or more people that were vaccinated. So it works. The difference is huge. And I showed you the map of the Northeast in Connecticut compared to the South. And the South is greatly affected. Why is that? Because only 45, in some cases, 30% of the population is vaccinated. So this virus, the Delta variant in particular, finds a fertile ground. It's like, the virus loves being down there because it finds people that are not vaccinated, and it can replicate, and it can actually bring them into the hospital and kill them. which in Connecticut, even though we've had some breakthrough disease, those people have not been very sick, very mildly ill. So the vaccine still works. Now we are talking about boosters, which we can touch upon at some point, but the vaccine still works, even if there's some breakthrough disease. It prevents you from getting very sick, coming into the hospital. It prevents you from dying.
Okay, so I think we have a ton of questions. So I'm going to ask the team to help us out with the questions. Mr. Fergus?
Thank you. Yes, thank you, Dr. Torres Rodriguez and Dr. Salazar. We have questions that we've received through the Welcome Center, our health services hotline, and then a number of questions coming through in the YouTube chat this evening. How will schools be safe if all of the students are returning to in-person learning and in some instances double the number of students in a classroom?
Yeah, thank you for that question. So, there are two things. Safety can be defined in many ways, but I think what the schools have done, and you heard Dr. Torres Rodriguez give you the layout of how you're going to do this. The first thing is the kids have to wear the mask. That's really important. Whether they're vaccinated or not, they have to wear a mask. This piece of, this is what we used for a long time. And I'll give you a story that hopefully will convince you that the mask actually works. Connecticut Children's, we have 2,800 people that work at our institution. At the main hospital in 282 Washington, we have on any given day, we have 1,200 people that are coming in and out to take care of just the staff, take care of the kids, so the cafeteria, the people who clean, the physicians, the nurses, the respiratory therapists. And we never closed. We never closed. A single day of the pandemic, we never closed. You can't close a hospital, right? And we came in in the middle of the most, the hottest days of the COVID pandemic. And guess what? We kept the staff safe. And how did we do that? And we were taking care of kids with COVID and patients with COVID. How did we stay safe? Here we go. Number one, the mask. Number two, we wash our hands. Number three, if we were sick, we didn't come in. And number four, we did testing when somebody was symptomatic for COVID-19. And then, of course, we did limit, some of the big conferences that in the past we might have had medical students, nursing students, even some high school students that would come in. Those we limited to a certain way. So I think what the school is doing, which I think is the right answer, is you got to, first of all, the teachers are vaccinated. That's great, as much as we can. I'm hoping the over 12-year-olds, if you haven't been vaccinated, please get vaccinated. That's another piece of insurance. And then the distance, I think, is 3 feet, which is we recommended with a mask. That's been shown that it's effective. And then of course you'll have outside activities that are going on. And so, and I think there are many other mitigation things that have been done. I've read the whole plan by the health department, the state health department, which I think has been followed to the book by Dr. Torres Rodriguez. And the last thing I'll say is we have to be vigilant, of course, and we have to be nimble, and we have to be transparent. If for some reason there is we have a large number of kids that somehow become infected in classroom A, classroom B, we have to be paying attention to that, and we have to monitor it, and we have to communicate with the parents. That's what I think it's going to be very, very important. So I like the plan. I like the recommendations. I would encourage you and your kids as they're coming in to please wear a mask. That's going to be very important.
And we will continue to provide, masks to all of our students as well. And, the one mitigation that we're also doing, which is a recommendation, but we're actually taking a step further, like I mentioned before, so cohorting, right? Keeping our students in pre-K through 8th grades in their cohorts, traveling together in the same group. Mr. Fergus, next question.
Many questions. Why is there no distance learning or remote learning option this year?
I will leave that to Dr. Torres Rodriguez. I think he's best at answering that.
Yes. So at the state level, there is no remote option Again, based on all of the other factors that we have in front of us, the fact that there are vaccines available, right, to 12 and over, the fact that we continue to implement the mitigations. And last year, I mean, our mitigations worked. We still had students, in our classrooms, and our mitigations worked. And so we don't have the capacity to do what we did last year, right, in terms of offer synchronous learning. Our teachers, I'm so grateful and inspired by the work that they did, and they did the best that we could. And our parents, right, you all did the best that you could as well, trying to be a teacher like on the other side of the screen. It's really hard and it's not sustainable. The situation is also very different than it was last year. And we will continue to implement the mitigations. But as Dr. Salazar said, we continue to monitor this every single day. Every single school has their health and safety team. We have our health and safety team at the district. We're constantly looking at the changes, communicating with local and state health officials. And if it requires that we make any shift, we will do that. But at this point, where we are is starting with, all students in person.
Follow up to that, what about the students that are too young to be vaccinated?
So let me answer that question. And of course, we do want everyone to be vaccinated. And I'm very hopeful that for the 5 to 12-year-olds, one of the mRNA vaccines will be hopefully approved very shortly for emergency use authorization. And at that time, I would obviously recommend that the kids get vaccinated. And we're going to do everything we can as when that option becomes available to work with the schools and make the vaccine available. Believe me, the sooner we have it, I'll be happier. Now, I think the experience from last year for the schools that opened, and many school districts opened, is that the younger kids, and the nature of it is that the younger kids are easier to cohort than the older kids. My kids are not teenagers anymore, they're older, but they try to contain the 13, 14, 15-year-olds is much more difficult. That's why vaccination is critical there. But kindergarten, first grade, second grade, those bubbles of safety, I think, are the ones that are very useful. And yes, it'd be nice if we had the vaccine, and I hope the uptake is really good when that happens.
Go ahead, John, with the next question.
There were a number of questions about pre-K students. What is the practice for safety there?
So the mitigations are across all grades. The only mitigation that is different is for 9th through 12th in terms of the cohorting, right? As some of us that know the high school experience and the scheduling, our high school students have different courses that they have to take. And so they cannot necessarily travel within the same group. But all of the other mitigations, even for pre-K3, pre-K4, right? The masks, the distancing within, at least 3 feet, definitely the cohorting, the continuous hand washing will be implemented in those lower grades as well.
When there are cases, can you describe the procedure and how that's communicated to families?
Absolutely. I'm actually going to ask Ms. Deb Kamaitis to share the process that we engage in for contact tracing and then communicating. And also if you can talk about how we share the data with our community.
Absolutely. Thank you, Superintendent. When there is a positive case in a building, if it's a positive student case, we speak to the family and we get all of the necessary information that we need to do a really complete contact tracing process in the school. So we would follow when the student was in school on the days that he or she may have been contagious, and we look at who would have been a close contact to the student. And then we create lists and we look at areas like classroom, lunch, recess, hallways. We're very thorough in this process. And then the school nurse will reach out to those families and explain that the close contacts would need to quarantine for a period of 14 days. And the nurse also gives the family a lot of other information about testing opportunities and signs and symptoms of COVID. So that's sort of a nutshell, the process in the nutshell for contact tracing in the schools.
And if the student is vaccinated, I know that, right, if the student is vaccinated, there is no quarantining necessary if they're asymptomatic.
That's correct. That's, yes, for our older students, 12 and up, if they are vaccinated and they're feeling fine, if they're a close contact to a positive, but they're feeling fine, they do not need to quarantine.
And our nursing staff across all of our schools, we do have tests that are available if anyone has a symptom.
Yes, absolutely. We have rapid testing available in all of our nursing offices. If a student becomes sick during the school day, the nurse will call the parent and ask if they're interested in having a rapid test done. And the nurse will do that. It takes about 5 minutes, and it's usually done by the time the parent can get to school to pick up the student.
Ms. Kamaitis, I know that sometimes we have staff joining us in these sessions. And so how about for staff, the quarantining and that process? What is the length of time? Because I know that it's different for staff.
So staff quarantine for 10 days. And the reason we do a quarantine period of 10 days for staff is that it's really important that from day 11 to 14, they self-monitor themselves for symptoms. And we have a method of doing that, and that's our daily health screen, or COCOMO, that they would be required to fill out from day 11 to 14, because the incubation period for the disease is still 2 to 14 days. But we do require our students to quarantine for the whole 14 days to be extra careful.
I'm going to actually also ask Chief Avila can you also describe the seating charts, right? And why seating charts are so important, and we're requiring all of our teachers to have seating charts?
So we require that all, regardless whether it's in the classroom and during any activity in the school and at lunchtime, and even on the bus, that we require seating charts so that at any given time, if we have to contact trace, we are well aware of who's sitting next to each other, as well as the amount of distance that they are with each other. So that if we have to quarantine, in the event that we have to quarantine, we're clear about who we have to contact and provide the necessary precautions if necessary.
Thank you. And I see Chief Blackburk, I see your hand up. So if you want to jump in here. Maybe not. Okay. John, next question.
Going back a little bit, there are a number of comments regarding the plan for quarantining for vaccinated individuals, and considering that they can still spread the virus. How is that? How does that make sense if they can still spread the virus?
So I can try to respond to that. So it is a great question, right? I mean, I think none of the systems are fail safe, and we just have to be transparent about that. And I want, before I answer that question, I want to sort of go back to the prior commentary. And if you're a parent listening to this town hall or a staff member, I think what's really important, and this has to be a compact between teachers and students and parents, and it's got to be based on trust. That because we want to keep the schools open, we want to get the kids back to learning, because that's good for their mental health. It's good for their overall wellness, as opposed to being at home, which was very difficult last year. So how are we going to do that? I mean, one of the things that's very, very important is that if somebody has symptoms, teacher, staff member, or student, please do not come to school. That is the compact. Now, if you develop symptoms in the school, then you have the school nursing team, Debbie Comides, others that can actually make sure that you get tested while you're in the school. But if your kid has a cough, a runny nose, a fever, can't smell, can't taste, anything that doesn't seem right, it is imperative that you connect with your primary care providers, your pediatricians, the school nurses, your own doctors if you're a staff member, and get tested. I think getting tested, which is readily available now, testing is really easy, which was not the case a year and a half ago. A year and a half ago, things were very limited, which made it very difficult. Get tested, because then we can know if you're positive. And then in that situation, of course, you have to stay home if you're positive. And it's really, really important. Now, if you're vaccinated and you're symptomatic, you still need to be tested. That's going to be really, really important. Especially as a teacher, if you got the vaccine back in January, let's say you come to the month of October and you haven't had a booster 8 months later, 9 months, that's a window that you may get infected. If you have symptoms, get tested. The question was more, what if you are totally symptom-free, you were vaccinated, can you shed virus and infect? That theoretically is possible, but if you're wearing a mask, the amount of virus that you're shedding is very low. And if you follow the rest of the guidelines, the likelihood that that person is going to transmit anything to anyone else is extremely low. Extremely low. And so in those situations, that's why the guideline is if you're asymptomatic, even if you were exposed to somebody else and you're wearing a mask, you can safely return to school, and the likelihood you're going to infect somebody else is very low. It's not zero. I want to be absolutely transparent about that. This virus is highly efficient at transmitting, but it's the best we can do to try to minimize. The biggest problem is when somebody comes into school symptomatic, and if a 12-year-old comes into the classroom coughing and sneezing, and they didn't stay home that day and got tested, then yeah, that's going to create a problem for that classroom, which is going to be minimized by the mask wearing and the spacing, but it won't be zero. So it's a lot of personal responsibility that we have to take care of each other to be able to keep our schools open, which are going to keep the kids healthier from a mental health perspective, from a learning perspective, so they don't get further delayed another year because of COVID-19. I'm not sure that answers your question, but that's my best chance at giving you my recommendation.
Thank you, Dr. Torres Rodriguez. We are running out of time before our next session. So before you close it out, if you could just clarify, this is brought up several times, how students will learn if they do have to quarantine at home.
Yes. So Ms. Comides, you can clarify, students will learn via communication with home. We contact the home, the families, and let them know, not only of the student that is either the student that tests positive or if he or she has been a close contact. And so that is outreach that is done by calling the home. And then if there is a case in the school, Chief Avila, how does that get communicated to the school?
Just to clarify, Dr. Torres Rodriguez, do you mean if someone has a case at home?
Oh, you know what? That's a great question. John, was the question as to how does a family notify the school if they're?
Yeah.
So we said that there was no remote learning. So if someone has to quarantine due to a case close contact, how would they learn at home?
Yes, and so that is very different. That is not remote learning, right? That is providing students an opportunity to access via their device. Either asynchronous, where their activities are already developed and ready for the student, or perhaps having an opportunity to connect with someone at the school when they are quarantining. Chief Avila, anything else that you would add?
No, that the student would have the opportunity, depending on the situation, may have the opportunity to join the class virtually. Sometimes if not, then they will also have the opportunity to have engagement with the teacher virtually as well.
But that is not for a prolonged amount of time, which is why it's not virtual learning.
Right.
That was a great question. And we are, for those new families to Hartford Public Schools, we do have devices, our Chromebooks available for students, and for the little ones, we also have iPads. And so we will make sure that you all have access to those if you're new to us. John, I think that was our last question. I know that we had more questions, but know that what we usually do is we take all of the questions and then we turn them into a document, right? A frequently asked questions document that we share with all of our families. So we will certainly do that as well. I want to thank you all for joining us for this session. We know that we have many, town halls that we're going to continue to schedule throughout. And we're in this, like Dr. Salazar said, we're in this together. I know that there are still hesitancy and fears and frustrations or anxieties. At times we feel those too. We here in Hartford Public Schools feel those, but we are confident that we are going to do the best that we can, standing firm on all of our mitigations as we did last year, and communicating regularly with all of you any of the changes that we have to make. So we want to thank you for your partnership. And let's wish all of us a great